Hi everyone, my name is Alex Chapman, and I'm going to be presenting some materials here on natural language processing in medicine. First, I'll introduce myself. So my name is Alex Chapman. I graduated from the University of Utah with a master's in biomedical informatics. I currently work as a data architect at the University of Utah in conjunction with the U.S. Department of Veterans Affairs. And within this job, my main interest is applying data science to epidemiology or clinical applications. So what is NLP and why are we interested in it with healthcare? So NLP is a subdomain of artificial intelligence, which deals with extracting information from unstructured text. So the reason that we're interested in this is that structured data, like ICD-10 or SNOMED, has a lot of limitations. So for example, those code systems are incomplete. You, as a clinician, can't say everything that you want to there. There might be some concept or some nuance missing. And you can't add details. You can't add like why you made a certain decision or if you're sure or not that some diagnosis was made. These coding systems can also be just not used correctly. So lots of studies have shown that people don't reliably use diagnosis codes to represent the actual diagnoses that a patient has. And so a lot of these limitations are addressed by clinicians in the free text narratives. So you may be familiar with the kinds of text that exist in an EHR. So for example, a discharge summary. And in an exam, in a document like that, you get a lot of information about the patient's care, their diagnoses, their treatments that they have. These are really rich, detailed narratives. So we won't be able to leverage this information, but a lot of this is unstructured, meaning that while we as a human can look at it and gain a lot of new information from it, there's some additional work that we're going to have to do in order to make this computable. So where is NLP used in medicine? Well, one subdomain is research. So you can use NLP, for example, to do cohort selection for clinical studies. So let's say that you want to study patients who have a family history of breast cancer and are over 30. That family history of breast cancer might not show up in the structured elements of the EHR. So NLP offers a way to mine through a patient's record to find potential candidates for this. We can use NLP for phenotyping, so extracting the diagnoses that a patient has in maybe a more complete way than what you might find in like the past medical history or problem list. NLP is finding more traction lately in the field of epidemiology. So you can apply it to biosurveillance, and I'll say a little more about my own work in this later. You can use it to, for example, identify cases of certain conditions. So for example, COVID-19. Sometimes diagnoses of that are missing in structured data, and the text could offer an alternative source. Or you can use it for syndromic surveillance. So for example, you can use not just clinical, but also social media data to see if a bunch of people on Twitter are suddenly reporting that they have symptoms of a cough and fever. And that could represent some new outbreak of COVID-19 or some unknown disease. And a popular application in the US, at least, is billing and administrative purposes. So it's not an uncommon business model for an NLP system to extract patient diagnoses or procedures and use that to bill an insurance company or the government for reimbursement. So those are some high-level examples. I'll give you a few specific examples of what I do with NLP. So like I mentioned earlier, biosurveillance. So for the past 6 months or so, like many other people, I've spent a lot of time working on fighting COVID-19. And so I've been at the Department of Veterans Affairs working on developing a system with my team that identifies positive cases of COVID-19 from clinical text. So some patients might come in and they might have COVID-19, but that may not be documented in any structured element. So for example, if they get a test done outside of the Veterans Affairs, and then they come in and get treated, we know when they're admitted that they are COVID positive and they're treated for that, but we might not have access to their laboratory results. So text offers kind of an alternative form of finding things like this, finding these positive cases. So I've given a link here to a manuscript which is currently pending review for a workshop coming up in a couple of weeks. But if you're interested, you can read through this as an example of how the system was designed and how it was used. One example is here. So you can see here that the patient presents for possible COVID-19. His wife recently tested positive for novel coronavirus. So we're going to use this as a use case later in a hands-on application. But you can see that even though COVID-19 is mentioned multiple times, the patient doesn't actually have it. And so you need to use some more sophisticated NLP methods to be able to recognize that and make the classification here. Another project I'm working on right now is veteran housing status. So checking whether a patient is stably housed is really important because a patient's housing status is really effective on their health. So if the patient is homeless, or if they're in an apartment but maybe at risk of being evicted, those could lead to adverse outcomes and more healthcare challenges for them. Whereas if a patient gets a new apartment and is stably housed, that's going to be a better outcome. So this is a little less of a clinical concept, but still very relevant to a patient's care. Socioeconomic data is not reliably stored in an EHR, so you can't rely on structured data to tell whether a patient is homeless or not. And the way that we're using this is to evaluate the effectiveness of housing programs for getting veterans to be stably housed. And finally, one last example that I'll reference that we'll look at later in the workshop is identifying evidence of surgical site infections following a surgery. So what we did in this project, and I did this, this was my first NLP project that I ever did, and I worked with a surgeon as the PI here, is to identify concepts like fluid collection or abscess, things which might represent a surgical site infection in a radiology report, and connect it to the body location where that occurred. And again, here's a link to the manuscript. So, with that as a background, what we're going to do today is we're going to look at how to do clinical NLP using Spacy and using some tools which build on top of Spacy. And a few of these activities will be kind of just demonstrations showing you how I might perform a task like this with some example texts. And then you will go through and you'll apply the things that I show to build systems to extract these sorts of concepts. So I'll see you in the next video.